Assalamualaikum and good morning to everyone. My name is Channa and today our group will be present about employees' stress and well-being at Avisena Women's and Children's Specialist Hospital. But before that, stress is a natural response that arises when work demands exceed an individual's ability to cope, and in the workplace it can affect health, focus and overall performance. In contrast, well-being refers to the state of physical, mental and social balance where employees feel supported and satisfied in both their professional and personal lives. Managing stress and promoting well-being are essential in maintaining productivity and creating a positive work culture. With this concept in mind, we now turn to the background of Avisena Women's and Children's Specialist Hospital, the focus of our study. Avisena Women's and Children's Specialist Hospital was established in 2019 as Malaysia's first private hospital dedicated to women and children. The hospital operates a 19-story facility equipped with 130 beds and ICU, HDU and advanced operating theaters. It offers specialized services in obstetrics, gynecology, pediatrics, neonatology, fertility treatment, surgery and emergency care. Avisena has earned two prestigious awards in 2022. First, Women's and Children's Service Provider of the Year, and the second one is Women's and Children's Specialty Hospital of the Year. The hospital culture is built on excellence, continuous improvement, integrity, passion, and empathy, which guide commitment to both patient and staff well-being.
From our study, we identified several key stresses affecting staff at Avisena. Heavy workload and long hours are the most pressing issues, especially in the accident and emergency department where cases are unpredictable and often urgent. According to the transactional model of stress and coping, stress happens when job demands are greater than the resources or coping strategies available. Nurses here often face situations where no matter how skilled they are, the workload simply exceeds their capacity, which creates constant pressure. Another stressor is emotional strain. Staff are repeatedly exposed to trauma, critical illnesses, and even patient death. The Job Demands Resources JDR model explains that when emotional demands are very high, but supportive resources such as counseling or recovery time are limited, employees are at greater risk of burnout. This is exactly what nurses experience. They give emotional care daily, but they are left with a little support for themselves. A further challenge is the organizational gap. While Avisena has flexible working hours and some wellness programs, there is still no formal mental health policy or structured support system. This makes it unclear for staff where to seek help when they are struggling. From the JDR perspective, this lack of organizational resources leaves employees vulnerable. Theory also suggests the importance of employee assistance programs to provide confidential counseling, resilience training, and a clear support structure, which are currently missing here. Finally, work-life imbalance is a major stressor. Long working hours and unpredictable schedules make it very difficult for staff to spend time with their family or rest properly. The work-life balance theory shows that without healthy boundaries between professionals and personal life, employees are more likely to suffer health problems and long-term dissatisfaction. This imbalance reduces overall well-being and increases the likelihood of turnover in the long run. Okay, now I will present the impacts on well-being. Workplace stress creates a serious impacts on staff well-being in several ways. First, there are physical health issues. When stress builds up, many employees experience constant fatigue, recurring headaches, sleep disturbances, and low energy throughout the day. These physical symptoms not only reduce their stamina at work, but also make it harder for them to recover after long shifts. Over time, this can weaken their overall health and increase the chances of chronic illness. Stress also affects mental health. Nurses and healthcare staff often feel anxious, easily irritated, and emotionally drained. If these issues are not addressed, they can escalate into a depression. Mental health struggles affect how staff interact with colleagues, respond to patients, and manage the emotional demands of their job. Another major impact is burnout. Burnout is more than just being tired. It's a state of emotional exhaustion where staff lose motivation and begin to feel detached from their work. Their sense of professional achievement drops, and this can eventually push them to consider leaving their jobs. In healthcare, this is particularly dangerous because burnout directly affects both the employee's well-being and the quality of care given to patients. Stress further reduces focus and productivity. When someone is constantly under pressure, their ability to concentrate declines and mistakes become more likely. In a hospital environment, even small errors can have serious consequences for patient safety. Reduced productivity also means a slower performance and lower efficiency, which adds to the overall strain on the organization.
And next, I will explain summary of interview findings. Our interviewee was Puan Fatiha, a senior clinical nurse who has served at Avisena for 11 years. 5 years at the old Avisena Hospital, and after that, Avisena built another new hospital, the Avisena Women's and Children's Specialist Hospital, and was sent to work until now. Through her insight, we learn about the real challenges of workplace stress in healthcare, as well as support the system that helps staff cope. On the positive side, she emphasized that supportive colleagues and empathic managers play an important role in helping staff cope with stress. This reflects concepts such as social exchange theory, where trust and fairness in relationship encourage motivation, and emotional intelligence leadership, where managers show empathy and understanding towards their teams. These interpersonal supports make a big difference in helping us stay resilient despite high pressures. On the negative side, there are still gaps that create challenges. Avisena does not have a formal mental policy, and there is no structured managed training to identify or handle staff stress effectively. In addition, while the hospital provides wellness program and flexible work arrangement, many employees cannot fully benefit from them because of heavy workloads and demanding schedules. So, when we look at the overall picture, we can see that Avisena has a caring approach to its staff well-being, but most of its strategies are still reactive rather than proactive. To make it more effective, the hospital would need clearer policies, leadership training, and structured initiatives that truly allow staff to balance work and personal life.
Now, I will present the recommendations together with their solutions. The first recommendation is to establish a formal mental health policy and employee assistance program, which is supported by the transactional model, showing that stress can be reduced by strengthening coping resources. Through the EAP, employees will have access to confidential counseling, workshops, and helpliness that help them manage stress effectively. The second recommendation is leadership and manager training, where the solution is to equip managers with emotional intelligence skills so they can detect early signs of stress, provide empathy, ensuring that staff feel supported, and preventing burnout. The third recommendation is to strengthen work-life balance initiative, supported by the work-life balance theory, which highlights that maintaining health boundaries improves satisfaction and prevents health issues. For example, nurses should be encouraged to take a leave and use flexible hours without guilt, while also joining wellness and mindfulness program. Altogether, these recommendations and solutions will help Avisena from a reactive approach to a proactive and sustainable system of support for employees.
In conclusion, Avisena staff face stress from heavy workload, emotional strain, organizational gap, and work-life imbalance. These stresses cause physical, psychological, and social impacts, leading to burnout and reduced patient safety. Our interview revealed a supportive culture, but the current system is reactive. We recommend a formal policy with EAP, leadership training in emotional intelligence, and stronger work-life balance program. Our key takeaway is carers also need care. By protecting employee well-being, Avisena can ensure safe, high-quality patient care.